Hello, good afternoon, everybody, and thank you so much for joining us for another Facebook Live joint with the Berrien County Health Department and Spectrum Health Lakeland. Today we are joined by Nikki Britton, the health officer for the Berrien County Health Department, and Dr. Lauren Hamill, the president and CEO of Spectrum Health Lakeland. Thank you both for being here so much. We can jump right into it. We've got a lot to cover today in our COVID-19 update. So Nikki, I will start with you. Can you just give us an overview of where we're at with the numbers of cases that we've been seeing here in Berrien County?
Yeah, absolutely. So we're sitting at pretty close to 4,900 cases right now is what we're reporting on our dashboard. When we throw in the probable cases as well, we're definitely exceeding 5,300. And really what we're seeing is we're seeing a lot of growth in our confirmed cases continuing. We spoke last week and we've spoken in some other venues just talking about how much our 7-day average number of cases that are being reported to us each day has been climbing dramatically pretty much since the very beginning of October. So we've seen a 12-fold increase in number of cases over that 7-week period of time. We're seeing hospitalizations increase as well, not to the same magnitude, but we are seeing that increase in hospitalizations. And I know Dr. Hamill will share more about what this is looking like in the hospital. But the thing that we're really paying attention to is with the exponential growth of infectious diseases is so we're looking at pretty much every 10 to 14 days, we've doubled the number of cases we're seeing daily since the beginning of October. So from November 8th to today, we've mostly doubled. Last week when we did our last Facebook Live, we were talking about how we could be close to 200 cases per day by Thanksgiving. And today we're at 158 cases per day as our average. So we're actually on course to hit that 200 number by Thanksgiving. What that means is then 2 weeks after that, we're likely to be at 400 cases per day if we keep this trend going. And we share these numbers with you for lots of reasons, but one of them is to really understand that each time a person who's infected with COVID-19 prevents that transmission from going elsewhere, that helps stop that exponential growth. We want people to be stopping those lines of transmission so we don't continue to see this growth. That doubling every 10 to 14 days really does it really leads to cases growing very rapidly, a lot more rapidly than we could potentially put the structure around to support.
Can you give us any idea on why we're seeing such a surge right now? Why did we have this sudden increase in cases in our community?
Yeah, I mean, there's so many reasons, and I don't think we'll ever be able to pin it on one thing. I think it's a confluence of many things. We do know that in mid-September, that's when we started having increases in our gathering sizes. And so that could have been an opportunity for there to be a bit more of a foothold and some opportunity for viral transmission. But we also know there's things like the weather, it's getting colder outside. And so more people who had been over the summer and in September gathering with friends and family and doing some more social activities or other types of activities outdoors, many of those things have moved indoors. And we know indoors is riskier and more likely to cause some transmission. And so really once the virus starts to be in the population and that exponential growth really does make this go faster. So, 1 becomes 2 and then 2 becomes 4 and then 4 becomes 8 and it just really amplifies quickly. So definitely social gatherings, just having more contact with other people, moving things indoor. And then another just wild card factor here too is just pandemic fatigue. We're all pretty tired of doing these things. We all want life to go back to what normal looks like back in February or in 2019. And so I think that is causing some of us to be feeling just fatigued with the diligence with the protective factors that we need.
One more question for you, Nikki. So we know that the health department has been very busy in doing its best to contact all the people who have tested positive, but we also know that we are relying on individuals to take action immediately and not wait for a phone call from the health department if they do test positive or if they are exposed. Can you quickly remind us of some of those guidelines for isolation and quarantine?
Absolutely. So if there's some sort of indication that you may have COVID-19 and you have sought a COVID-19 test or been ordered to have a COVID-19 test, at that point in time, you need to isolate. If there's reason to believe you might be infected, please isolate, stay away from others, stay home until you get your test results. So in theory, when you get your positive results, you should already be self-isolated. If you're positive, you need to remain self-isolated for 10 days following the start of symptoms or starting from the date that your test was collected if you were not experiencing symptoms. So if folks can isolate while waiting for test results, and then you must isolate when you know that you're positive, that's really going to help slow transmission and reduce the exposure to other people. If you think you've been exposed to somebody who has COVID, it is also important that you quarantine, and that means you need to stay home and away from others, limit contact with your household contacts for 14 days following that exposure. And we do have some guidance on our website and our Facebook page. So you can scroll down on our Facebook page to see some of this information. And our website is www.bchdmi.org.
Thank you. Dr. Himmel, moving to you into the hospital, we know that you're also very busy there treating lots of patients these days. Can you give us an idea of what the situation is at the hospital? What kinds of numbers of COVID patients are we seeing right now?
So as of this morning, we had 64 patients with diagnosed COVID in the hospital. That included 3 in the ICU. That is gradually climbing. Our 7-day average last week was in the low 50s. Our 7-day average this week will be in the low 60s. You know, if that trend continues, you can see pretty quickly things escalate.
And right now, what are levels of staffing look like? We've heard reports from across the country that staff are fatigued as well and starting to burn out or get sick themselves. Can you tell us more about what's happening with your critical staff there?
I can tell you that clinicians are tired to the bone. We are working extremely hard. And when COVID increases across the community, it increases with our team members as well. Their rate of getting sick is about the same as everybody else in the county. And so we are short-staffed. And we expect that, of course, to get more challenging as well. Is part of the reason we're just pleading with our friends and neighbors, do everything you can to prevent exposure. And Nikki gave a very nice answer about where is COVID coming from. Just remember, it's mostly coming from people that you don't know are sick and they don't know they're sick. It is mostly through asymptomatic transmission. As we've cautioned our staff, you're at risk for getting COVID when you're closer than 6 feet. You're at risk for COVID if you're not wearing a mask that covers your nose and mouth. You're at risk for COVID if you're not keeping your hands really well sanitized. And there are a lot of things that people do: visiting grocery stores, shopping, full service restaurants, church services, bars. There are things that people do where as part of the activity, you expect to be closer than 6 feet, or you expect not to have a mask on, or you might not keep your hands as clean. But those measures work and will help limit the spread, and hopefully will make sure we don't run out of the resources necessary to take care of our friends and neighbors. A few weeks ago, we had just all the supplies we needed. Now there are some supplies related to testing that are becoming a much shorter supply, where we're being limited on how many we can order, and where we're working much harder to maintain a supply adequate for the next few days as opposed to the next few months. But we expect that as this escalates around the country, we expect it to be real challenging. And just one of the data points I would like to share with you folks. Just consider these numbers. So far in Berrien County, about 1 in 30 of us has a diagnosis of COVID or has had. Now that may alarm some of you. Well, that's a lot. That may not alarm others. Well, that's not very many. But here's the significance. We're having this kind of struggle with only 1 in 30 with a diagnosis. What if 4 in 30 had a diagnosis? We're completely overwhelmed. So 1 in 30 has had a diagnosis. About 1 in 100, or about 1 in 9 or 11 in 100 will be sick enough to be in the hospital. So you get COVID and you have overall, and I recognize this is age adjusted, I'll talk to that in just a minute, but overall, if we make 100 diagnoses, we expect 11 of those to be hospitalized. So when Nikki talked about how many we're diagnosing in some days, over 100, that just committed us to take care of 11 more people with an average length of stay of 4, 5, 6, 7 days in the hospital, if you're lucky. That's very significant. If you're one that gets admitted to the hospital, remember that's about 1 in 9. You have about a 1 in 6 chance of ending up in an ICU. And you have about a 1 in 9 chance of not surviving COVID. Now, it's true that about 95% of the deaths are in those 60 years of age and older. And of course, there are a lot in the 70 and 80 category, 95%. But the 5% mortality that is occurring in folks between 40 and 60 is still significant. You have about a 1 in 400 chance if you're within that age band, 40 to 60, if you get COVID, you still have about a 1 in 400 chance of dying. So this is something we really encourage folks take seriously. That is totally different than influenza. A lot of folks still want to compare it to influenza. There's never been a time there's been a 1 in 400 chance of dying of influenza in that age band of 40 to 60. That is what we're seeing with COVID. It continues. I would just tell you, we have everything we need to take care of you. We have dexamethasone, we have convalescent plasma, we have remdesivir, we have monoclonal antibodies, we have ventilators, we have oxygen, and we have folks that with courage in their eyes and compassion in their hearts and smiles on their faces will take care of you. But it is exhausting. And we still have some risk of losing friends and neighbors when they get sick. Yeah. So I would just encourage you, it's not over yet. We have to be diligent. And if we come together related to preventing spread across our community, we will absolutely save lives.
Yeah, thank you for that. Nikki, moving back to you, can you comment quickly on the recent MDHHS epidemic orders that just went into effect earlier this week? What were the main highlights from those orders?
Yeah, I mean, so the intent behind the orders and a lot of the recommendations that are coming out of a multitude of places is really to limit the number of people that each person comes into contact with, especially that meaningful contact where there could be spread of respiratory virus, respiratory droplets. So the intent of the order really is to try to limit those gatherings and make sure that people are having fewer contacts with fewer people, and that those contacts that are happening are done in the safest way possible, distanced with masks, recommended good hand hygiene. So some of the types of gatherings that have been really told that are not permitted right now, one of them is just any type of indoor gathering. There are exceptions for retail and for public transit and workplace and things like that, but essentially indoor gatherings, especially of really large groups, just not allowed. For indoor gatherings at residential in homes, it really needs to be limited to 2 households. And then the recommendation is it's always the same 2 households. So instead of a different set of friends coming over each night, it's maybe just only the one set of friends is the only one that comes over, and there's 2 households that create this pod together. So those are some of the recommendations from MDHHS. Any work that can be done remotely is really encouraged to be done remotely. And there's also, to minimize some of the gathering, there's also a limitation on indoor dining in restaurants and bars. So I've already seen lots of examples of our businesses that have very innovatively either gotten some outdoor dining together that is still okay in the elements, or and takeout and delivery are also still available. There has been another move too to make all high school 9 through 12 grades 9 through 12 education needs to be done virtually, These are for 3 weeks under these orders. We're not sure what will happen after December 8th when the orders expire, but those are some of the key highlights. We do have more information about those epidemic orders on our website and our Facebook page, and you can find them on MDHHS's website as well. But the main point is to really try to avoid close contact with other people. When you do have contact, wear that mask, watch your distance, wash your hands. And the thing I would add to that too, that is becoming really, really important right now, is that if you have any symptoms that could be a respiratory virus, you need to stay home. We're seeing lots of reports coming through from positive cases who were convinced they only had allergies, or their symptoms were so minor they didn't think it could be anything. But they did in fact pass things on to others. So as much as asymptomatic transmission is something we need to be careful of, and so we need to assume every interaction could result in transmission when we're thinking about our own health and safety and those of others, we also need to be mindful of, yeah, you might be experiencing allergies and maybe this is something similar, but nobody can really tell. Until you've had a COVID test, we really can't distinguish between what's a cold, what's influenza, and what's COVID-19. So if you have any respiratory symptoms, this is not the year to try to earn the badge of honor of going to work while sick, sending kids to school while sick. This is really the year to take the time to stay home when you're experiencing those symptoms.
Excellent, thank you. Dr. Hamill, moving back to you, we heard from the beginning of this pandemic that it is a virus that has most severely impacted the elderly and those with chronic conditions. What else can you tell us about some of the trends in the demographics that we've noted here locally?
Well, certainly our experience parallels what others have experienced. It's certainly those that are older, those with multiple chronic conditions are much more likely to feel sicker, much more likely to need to be in a hospital, ultimately need an ICU or ventilation, and have a much higher chance of dying. On the other hand, we are seeing this is a very unusual virus. Not only does it attack lungs, this can attack your brain, your pancreas, your liver, your skin, your immune system, your clotting mechanism, the conduction system in your heart. We've seen all of those from this virus. And so it can attack any part of you and be harmful. And the story is not entirely told by just who lives and dies. There are folks that live that don't completely recover. It's being labeled mostly long haulers syndrome. And folks think they're over it, but they still have mental fog. They still have joint pain. They have shortness of breath and decreased pulmonary capacity. They've had damage in their heart or their conduction system. That's not incredibly common, but in a community like ours, we're already diagnosing that in a number of individuals that are younger. So it's not just the old folks that suffer from this disease, and it's not all that predictable on who will get that long haulers syndrome. You know, we encourage you to be careful. Even if you're in a low risk for death group, you can pass it on if you get sick, and you can recover, but not recover completely. You still feel ill with the virus. So we're seeing those trends, and they're disturbing trends.
Nikki, back to you, and Dr. Hamill, I'd love your thoughts on this question as well. When will we know if we're headed into the right direction? Things have been going in the wrong direction for the last several weeks. What will it take for us to determine whether we're turning it around?
Sure.
So, I mean, I think that we're monitoring lots of numbers. You can see lots of them on our dashboard. There's others that we're keeping an eye on internally. And what we really want to see is, first, we want to see slowed growth. We'd love to maintain some of the numbers that we're at. I spoke to earlier about how we're doubling the number of cases we're seeing every 10 to 14 days. I want to see that growth slowing, even if we're still seeing growth, starting to watch that slow down. Ultimately, I'd love to see us at a maintenance level. When we were in August and September, we bounced between 8 to 12 cases per day for like 8-9 weeks. So that was showing us that we were really maintaining where we were at. It was very stable. Now we're at 158 cases per day and climbing. So I want to see us level off a bit, or at least have a longer length of time for doubling, at the same time that we're continuing to see the number of amount of testing happening go up, or at least remain stable. So those are key indicators we're looking at. Same with hospital trends. We're seeing increasing numbers of people who are requiring hospital level care. We want to see that growth slow down and not be happening so rapidly. And then we want to see it maintaining. Eventually, we're looking for it to be going down, of course. But the first step is that slowed growth. And we really need to see these over a period of time. I mean, we're looking at 7, 14, 28-day trends that we can feel confident about what's happening. With the incubation period being 14 days, it could be 10, 11, 12, 13, even 14 days between the time somebody's infected to when they become ill or are continued to be infectious. So with those lags in time, we need to see these downward trends over a period of time.
Dr. Himmel, do you have anything to add?
Yeah, Nikki covered it. I just need to see a trend where we have more discharges than we do admissions for a few days. I mean, it's pretty simple. We know we're heading in the right direction when we're discharging more than we're admitting.
Yep.
So we've had some good news within the last couple of weeks with a vaccine candidate very soon on the horizon. We might hear an announcement within the next few days about whether that emergency authorization has been granted to Pfizer or Moderna. Can you give us an overview of what we can expect here in our community as that vaccine is rolled out?
Mm-hmm.
Yeah, so there's a lot of planning underway. We heard at a call earlier today with some state partners that Pfizer did officially submit their application for the emergency use authorization to the FDA today. So we're not sure exactly what the turnaround time and the length of review that undergoes, but there have been some planning around the vaccine potentially becoming available the first or second week of December. What's important to note is that there's the American Committee on Immunization Practices, and they go ahead and they establish priority groups and ordering, because the vaccine will be in short supply when it first comes out. And even when we have a second manufacturer, if it's the Moderna vaccine is approved next, we're still not going to have enough to do everybody. So a prioritization group has been set by that federal body, ACIP, and that will be part of the emergency use authorization and the guidance coming out. The first group, and where the most planning is happening right now, is there's two parts of priority one groups. And the first one is healthcare providers and people who are very likely to have exposure to COVID-19 patients and are at the highest risk of being infected due to that exposure. And then in priority 1B is where you would capture some more of those healthcare providers that may not have fit in that highest tier of risk, but also critical infrastructure workers, first responders. But also in that group would be people who are at highest risk of the severe complications and death. So those over the age of 65 and those with serious underlying chronic conditions. There's going to be more detail to come on what that looks like, but it could be March by the time we're in that 1B category, where we're starting to get beyond the healthcare providers, beyond the critical infrastructure workers. And it could be into May by the time we are equipped as a country to be vaccinating the general public. So some of these.
So Nikki, I turned 65 on Thanksgiving Day. So the day after, I'm going to be older than 65. Is that true? So I might even get in line for a vaccine. And I know there are a lot of folks thinking about, am I going to take a vaccine? I don't want to be in the first in line, but I'm absolutely going to take a vaccine when it's made available to me. We do that not just because we care about our own health. We do that because we want to make sure we're saving a hospital bed or an ICU bed for somebody that needs it. And I just hope if you're offered a vaccine out there that you avail yourself of that opportunity when it becomes available, and make sure you take yours as well.
Absolutely. And there will be an orderly process as to how we do that. I think there's been a lot of collaboration between healthcare partners across the state. There's been really concerted efforts here in West Michigan and Southwest Michigan to make sure everybody knows who's doing what. This is a logistical feat to be able to get this amount of vaccination out in pretty rapid, a pretty rapid time frame. But you know, Dr. Hamill, you're absolutely right. And I know I have heard from members of the public saying, well, I'm not going to be first in line. And I think it's really important to understand there are tens of thousands, if not hundreds of thousands of people who have already volunteered to be first in line and were part of the studies. There has been a lot of rigor that has gone into studying these vaccines and reviewing them. Emergency use authorization does not necessarily mean that there were a bunch of corners, you know, that were cut, or that it's not safe. There's a lot of data out there about the vaccine, and it's undergoing that review process, but it's an expedited review process.
Yeah.
Well, excellent. Thank you for your comments on that. And maybe we will be seeing both of you getting your COVID-19 vaccine when that becomes available in our community.
Yeah.
Last question, just to round us out here before our time is done. Both Lakeland and the health department co-signed onto an open letter to the residents of Berrien County that was issued just yesterday with a lot of other community leaders in government and business and nonprofit and healthcare, really with a plea to our community to continue with the preventative actions that we know will help slow the spread of this virus. As we conclude, can each of you maybe just pull out one of the main thoughts or contributions that you made to that letter as we close today? Nikki, would you start?
Sure. I mean, I think what I'll say is now is the time to act, because with that 14-day incubation period, what's going to happen at the hospital and who's going to need a bed for the next 2 weeks has largely been determined based on exposures that have already happened. And so a key theme in that letter and of our recommendations is we need to be proactive. We cannot wait until we're in a situation where healthcare may need to be rationed or where we're running out of PPE and staff and beds. We need to be proactive about this. I firmly believe this community can do that and will do that. And a part of that is painful choices. I'm lamenting the fact I had out-of-state relatives that were supposed to be coming and staying at my house and having Thanksgiving arriving tomorrow. We had to cancel our plans. It will be the first time our family is celebrating Thanksgiving with only our household members, but we're looking for the ways to find joy in it, and I encourage you to do the same.
No, I completely agree with that, Nikki. You know, these are tough times. You're exhausted. We're exhausted. We're sick and tired of COVID. I get that, but it's not over yet. And if we come together, if we reach in and are the most diligent we can be, the most careful we can be, looking out after our family's needs, our own needs, our neighbors' needs, we're going to get through this with fewer people getting sick and fewer people dying. You know, I love my friends and neighbors in Berrien County. I want you to stay healthy. I want those you love to stay healthy. I'm tired of burials in Berrien County related to COVID-19. You know, so I would just implore you, please do the responsible thing, do the loving thing, make sure that you're just as careful as can be. I know we're asking you to sacrifice, and I can tell you we're willing and are sacrificing right along with you. But I want to see us get to the other side of this and not lose any more of our grandmas and grandpas in this community. So please be careful. God bless you through the holiday season. I hope you have a wonderful Thanksgiving, and I hope you stay healthy.
Well, thank you so much both again for joining us, and for everybody who's tuned in today. That's all the time that we have for now, and we will be posting more updates, of course, on both the Health Department and Spectrum Health Lakeland's Facebook pages. Stay tuned for more to come. Thank you both.
Thank you.